Hello, welcome back to the channel, Farmer Trading Solutions. So today we shall be discussing powder dosage form. Remember, in tablets it is compressed, but here there are some drugs which appear strictly as powder dosage. They appear in powder form. Of course, pharmaceutical powder is a mixture of finely divided API with excipients. API, of course, with what? With excipients. Of course, they're in dry form. In dry form, they're either used for internal or external use. Now, what are the advantages of powders? Of course, they're chemically stable. It is a powder, more convenient to patient, rapid dissolution in the GIT, and easier to prepare. However, it's difficult to mask and present test. And of course, they are bulky. How do we classify powders dosage form? We have the bulk powders for external use, which what we call the dusting powder. If they are sterile, they are applied on wounds. Bulk powders for oral internal use. So for oral or internal use. When you have divided powders, unit those capsules. Of course, the capsule, inside the capsule you have a powder, except those which contain what? Pellets. In sulfation, because sulfation they are meant to be blown into body cavities. Of course, now antibiotic dry suspension for reconstitution. Now dry powders for reconstitution. Either these ones can follow under bulk powders for oral use, or powders for reconstitution, usually injection. So dry powder inhalers, sometimes the aerosols are in form of powders. Now let us go in details. So of course, these dry powders are free-flowing preparations consisting of one or more finely divided, finely powdered substances intended for external application. Now by finely divided substances, we are meaning the API, which is the drug, and also the excipients. Mostly used for superficial skin conditions, and not used for wounds unless they are sterile. Are you getting it? This means that if they are not sterile, they are not used for wounds. However, in case they are sterile, they can be applied on wounds. Bulk powders for internal use, they are the same, except that for them they are intended for oral administration. Of course, these ones are not sterile, not sterile mostly. We have those circuit tablets. They are those circuit which you just need to put in water and then you swallow. All of them in form of powders. Of course, the individual powders consist of one or more ingredients. Because one is in a single dose, they are wrapped in a single dose. White dummy pepper or a sachet. We have also the Windows capsules, because all of us know what is inside the capsule. That's why capsules are not meant to be open. You just need to take it the way it is. We have insufflation. These are intended to be blown into cavities. That's ear, nose, throat, and another cavity. Dry powder inhalers. These are for pulmonary delivery. For pulmonary drug delivery, used in decongestion, as decongestant, and also bronchodilators. Of course, what could be contained in the powder? What are the excipients? We have bulking agents, of course, starch, lactose, chalk, calcium carbonate, dissolvents, bentonite, kaolin, adhesives, sometimes coloring agents, flavoring and sweetening agents, and another in-house excipient which a pharmaceutical industry can come up with. So how are powders prepared? Of course, we have to weigh. Anyway, may not weigh initially, but you have to weigh initially, and then you do size reduction using a mill. The same equipment can be used as I explained earlier in tablets. Then you sieve the mill, you sieve the particles. It's good to weigh after this, because if you never know, you may have lost some ingredient. and any way of each, you mix and then you package and label. Again, this has been a short presentation. It has been brought to you by M Pharma Training Solutions. I always remain Wilson. Thank you for subscribing to my channel, and in case you haven't subscribed, click that subscribe button. Contact us, we shall always reply. Leave a comment, and thank you.